I'm Erica Sood. I'm a psychologist and researcher at Nemours Children's Health System in Delaware, and my research has been funded by ACCEL.
An important part of the Delaware ACCEL program is to bridge gaps between what researchers do and how community members are involved. Since the program began, partnerships between researchers and community members have been formed across more than 30 projects. And while the topics of the projects or the research may vary, one common theme is the practice of reciprocal learning.
I've been doing this work for about 7 years. I started with a study of interviews with parents of children with congenital heart disease to understand their experiences and needs, parents who received care at Nemours. I then moved on to partner with parents to design a program.
I have a child who was born with Down syndrome as well as a congenital heart defect. It was first diagnosed at 19 weeks gestation, so the impact of congenital heart defects started when he was 19 weeks all the way up until his first year of life. We had many doctor's visits, watching his weight gain, lots of medications, until at 3 months when he did undergo open heart surgery.
Congenital heart disease is the most common birth defect and involves problems with either the function or the structure of the heart.
You don't find people. It's really hard to, you don't just walk into the store and there's a CHD parent. That's a stressor for parents, that lack of support, that lack of knowledge, and that's part of the reasons why we've worked to set up these support groups for parents by parents.
It was a group of parents that all had the same common congenital heart defect or disease. In my case, it was a congenital heart defect. So it was a group of parents that were able to answer about 40 questions or more, and we were also able to compose the questions, so it was easier to relive those situations again to help other parents to go through it.
I learned so much by partnering with parents and families. They're the experts. They're the ones who've lived through this. And so by working with parents and families, I learn the research questions that are most meaningful to them and to the community. I learn how best to engage parents as both participants and partners in my work. And I learn how to best disseminate the results to the community.
The community came first. For us, certainly, being part of a supportive group of families and parents was, what we were looking for.
The difference that the research study was for me was based on the level of interaction between myself and other parents. It was a connection that was truly from the heart. There were different questions that were composed that were sometimes hard to relive. They were intense, but it allowed me to connect with the parents on a different level and become that resource for them continuously as they go through the same thing I went through.
Every parent has a richness of knowledge and expertise. Every patient has a richness of experience and subjective knowledge that is going to contribute. Even if they think that's all they bring, that's essential.
You never know what you're capable of until you try. And I wasn't prepared for having a child with special needs, but here I am rocking it. Just keep going. You never know what you can do until you do it. So just do it.
Whether you are a community member who wants to get involved or a researcher who wants to engage, please learn more by visiting www.de-CTR.org.